If you're a menopausal woman, what you learn on today's episode could just change your life. I'm Jane Hogan. This is Wellness by Design, and my guest today is Dr. Doni Wilson. And we talk about how we can prevent things like dryness, infections, and pelvic pain, and all kinds of other pelvic, we'll call them disorders, well into our freedom years and beyond. There's a lot of myths around women's health, and I think we're going to dispel some of those in this interview. So I'm really excited to share it with you. Make sure you stay till the end and hear about the gift Dr. Doni has for you. All right, I'll see you inside. Hi, Dr. Doni. So nice to have you here on Wellness by Design today. Really excited that you're here because I got a lot of women in my audience, and you are an expert in women's health. And so I know we've got a lot to learn from you today. So
So good
first of
to see
all,
you, Jane. Thank
yeah,
you.
yeah, great to have you here. I've loved you ever since I met you in person several times now, so it's beautiful. You became an expert in women's health, like specifically. Why did you decide to focus on women's health?
Way back when I was in my 20s and I was starting to deal with my own health issues as a woman. Back then, I had severe menstrual cramps, and I also had tested positive for high risk HPV virus. So I was in the gynecologist's office as a pre med student. At that time, I was a pre med student. And I was like, oh my gosh, this is scary. You feel isolated, you feel embarrassed, you feel like, who can I tell about this? Who can I ask about this? And you don't know what the doctor is going to recommend. And so I really found myself really compassionate and empathetic to other women who were going through that process. Meanwhile, I also was interning with a gynecologist and observing births and seeing what does a gynecologist obstetrician do, what does a midwife do. And I at the same time, I was also interning with other specialty types in medicine, but the specialty type that really drew me in was women's health. And it just became so clear to me. I was like, I am going to become a midwife. And then what was so interesting is I started having these thoughts. Why doesn't medicine include nutrition? At that time, it was like,
Couldn't possibly be related.
where did I have that thought, And so I just started asking that question out loud. And friends of mine said, well, what about naturopathic medicine? Naturopathic medicine does include nutrition and more. Preventive medicine, using herbal medicine, homeopathy, all kinds of natural approaches. And immediately I was like, that's what I was looking for. I couldn't actually believe it existed already. I thought I was dreaming something. And so I was like, and I went straight to Bastyr University. I was living on the West Coast at the time. And I went straight to Bastyr University in Seattle and walked in the door, and I'm like, I want to study medicine and nutrition. And they were like, you're in the right place. Because, of course, that's what they do at Bastyr University and other naturopathic medical schools. And they have, at Bastyr, they had a midwifery program also. So I was able to do it all in one place, in one institution, to get my midwifery certification as a home birth midwife, as well as a naturopathic doctorate degree. And I also completed a residency. And I came out just so excited to help women in a different way, different than what. Now, I'm also trained as a primary care provider. So I can do physical exams, I can do pap smears, I can do standard of care women's health. But I also am able to say, wait a minute, there's a lot of other practitioners offering those services, but there's not enough practitioners offering women solutions in situations where women are just not getting helped. Things like pelvic pain, vaginal pain, frequent infections, abnormal pap smears. And I know we're going to talk more about all these things, let alone even women who are dealing with miscarriage risk or endometriosis or irregular cycles or any of that. There's a lot that women deal with silently that there is help for from a holistic and naturopathic perspective, that there's just not enough help in the standard medical clinic.
Mm. Gosh, there's so much to unpack there. I love that you did this and took on this role, but specifically helping women. And you and I were chatting just before we hit record, talking about pelvic pain and how there's so few answers on pelvic pain. I see a lot of women, because people come to me with pain. I do see a lot of women with pelvic pain, and they're kind of like, yeah, you got pain, and they kind of put a label on it, but then not really giving any solutions, real solutions. So let's talk about like pelvic pain. What can cause pelvic pain, and then what are some of the solutions?
And when we say pelvic pain, it essentially means like anything that could lead to pain in the pelvic area. I mean, in some ways, that can even be a referral from a joint pain, right? If there's a pain in the hip, it could refer to pain in the whole pelvic area. So we have to consider even the joints as well as the colon, because also the colon goes down through the pelvic area. So if someone has constipation or colitis or other type of digestive issue, that could also be related to pelvic pain. And then we think of the vagina and the uterus, and also the bladder. So those are all potential. We need to be thinking what's all in that area that could be related to pain. And a lot of women, especially as women get to be over 65, also can experience pain on the vulva, which is the outside, right? Outside of the vagina, the outside of the body can become very sensitive and painful as well. And so we need to look at location and there may be more than one thing related. And when I, as a midwife and women's health expert, I especially focus in on the vaginal area and the vagina, the cervix, the uterus, the ovaries, and that even though women after menopause, they're thinking, oh, I'm postmenopausal, I don't have a period anymore. And we almost wish we could forget about that part of our body, right? We're like, okay, it's done. Let's not think about it anymore. But it actually is still a very important part of our body that we still need to think about. And I would even argue maybe we need to think about it even more postmenopausally. And so I think that a lot of women feel still maybe embarrassed, or they're not sure who to ask, or they're not sure what, maybe they ask the doctor, and like you said, they may not have really any solutions. And so women just stop asking and just start dealing with pain, dryness, discomfort, frequent infections. And it just doesn't have to be that way. I want women to know there's actually so much we can do to help you. So if you're dealing with pain, discomfort, infections, whether that's vaginally or in the urinary tract, the bladder, or on the outside, then there's help. Definitely know that there's help for all of these scenarios.
Mm-hmm. Well, I mean, I hear them saying different things. Obviously people are talking to me more about pain, so I'll hear about things like um, interstitial cystitis, or like general pelvic pain, or sometimes just in passing they'll mention, oh, and I have frequent urination. I have to wear pads or whatever in case of accidents, or they'll talk about dryness and things like that. And so I'm assuming, a lot of the things that I hear from people that are kind of root causes of pain in general are also root causes of, pelvic pain. So when someone comes to you with pelvic pain, like what are some of the first things you'll look at?
Well, definitely, I'm going to start thinking, especially for women, postmenopausal women. So we're talking women who are over 50, over 60, maybe even over 70. I'm going to right away be thinking about estrogen levels, because in years past, the media and women were taught to be afraid of estrogen.
Yeah.
Absolutely. There was a women's health initiative that came out 23 years ago, and it scared everybody, including us as doctors, because it was saying estrogen's causing cancer. And so everyone stopped using estrogen, including vaginal estrogen. And unfortunately, that has led to an increase in women experiencing pelvic pain, vaginal pain, and urinary pain, because when estrogen levels drop vaginally, they also drop in the urinary tract. And when estrogen drops, it increases pain, first of all, definitely, especially pain with sexual intercourse, or if you have pain when your doctor puts in a vaginal speculum, or even just pain. Just some women say to me they can't even wear pants because it hurts to put pants on or underwear on. And so then it definitely says to me, this is like, it doesn't need to be that way. We need to start thinking about, do you have low estrogen? Because the truth is that now, starting now, and this is 2025, research is coming out showing that the original researchers from the Women's Health Initiative 23 years ago came out and said they were wrong, that
Yeah.
the estrogen is not causing cancer.
It's so hard to change that mindset. I'm talking to people all the time, and they'll say, "Well, no, I'm not doing estrogen, not doing hormone replacement therapy because I know that's not good." I'm like, "No, it's changed now."
It's totally changed. It's so ingrained in us. It was such a fear that was built in for decades that it's going to take time. And so I recommend anyone who's got the red flags going up, look up the research, ask your provider. Definitely this information is changing, so much so that in the past, when your doctor would prescribe a vaginal estrogen, it used to have a black box warning on it that said warning against use of vaginal estrogen. And now in the United States, the FDA is changing this so that they're going to be removing this warning, because it's deterring women from using something that could actually help them, and it is not. Is the research is very clear that it's not associated with cancer risk. In fact, in the past, even for me, I've been practicing for 25 years. In the past, if a woman had a history of breast cancer, we wouldn't use vaginal estrogen. Now, in 2025, that has changed as well. Even a woman who has a history of breast cancer can potentially use vaginal estrogen. You definitely want to talk to your oncologist and your gynecologist. Don't just take my word for it, but I want you to know that it really could be a lifesaver, Jane, not just in terms of the pain, but we're talking about when estrogen levels are low. And for a lot of women, estrogen's low for decades, right? Let's say from age 50 to 100, estrogen being low means this estrogen is very, very low, is close to zero. And what happens is, not only do women then tend to have more discomfort and pain, but they also have an increased risk of infections. So if you are having infections, if you're having vaginal yeast, vaginal BV, vaginal HPV, which is human papillomavirus, or even high risk HPV, or if you're having bladder infections, or even interstitial cystitis, right away I would be thinking about estrogen, vaginal estrogen. And now, using what we call hormone replacement therapy, which is estrogen that's circulating around your body, right? If you swallow the estrogen or you put the estrogen on your arms, let's say, it's going to go into your bloodstream and circulate around. And that's an important consideration as well. But I'm specifically talking about vaginal use of estrogen. So it's usually as a cream or suppository of some type. And when we use estrogen vaginally, we're usually using a small dose, and most of it stays in the vagina. So it's thought that 10 to 15% circulates around the body. So most of it stays local to the vagina and the urinary tract. And so you don't have to worry about it circulating everywhere. You can be like, I'm just going to use a vaginal estrogen. It's usually, if you use a pharmaceutical form, it's going to be estradiol, again, as a cream or a pill that you insert vaginally. Or if you work with a naturopathic doctor, you might be using a different form of estrogen called estriol, which is E3, which is a more gentle but still effective form of estrogen that's usually from a compounding pharmacy. So you could use estradiol or estriol, and you're not using it every day, Jane. This is not something that the treatment's every day. This is, you use it a few days in a row to build up your estrogen levels, or maybe a week or two straight, and then you use it once or twice a week ongoing for the rest of your life. Even if you're 100 years old, you still need some vaginal estrogen in order to prevent infections. And I'm so fired up about this and adamant about this because I see women who are in their 90s getting bladder infections, even kidney infections, and sepsis in the hospital, having to go through month-long recovery processes to recover from a bladder infection that could have been prevented by using vaginal estrogen that is safe and effective.
So preventable. And when you're talking about these vaginal creams, I mean, I hear a lot of, and I've had guests on talking about hormone replacement therapy, but to make sure that it's bioidentical hormone replacement.
Yes.
Do you make a distinction between, or does it matter to you?
Yes, and so I'm so glad you're pointing that out. So what it is in the research from Women's Health Initiative from over 23 years ago, they were studying Premarin and synthetic progesterone. So what that means is it was these hormones that are made in a lab to mimic the hormones our bodies make. And that synthetic progesterone, or progestin, 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 is what's more associated with cancer risk. So we want to steer clear of that. We don't want to use a synthetic progesterones or hormones. We want to use what you said, which is sometimes referred as bioidentical, or sometimes it's called natural hormones, or it's in the form that our body makes. So estradiol is the form our body makes, progesterone in the form our body makes, so that our body's familiar with it, and there's no then the risk is, that's what eliminates the risk, because we're not using a synthetic hormone.
Okay, that makes a lot of sense. How readily available is this? Like, I'm in Canada. If I'm going to go to my family doctor here, are they going to be prescribing bioidentical hormones, or are they still going to be doing traditional? Or, I mean, is it easily available?
Well, when we're talking about a hormone replacement therapy like that is systemic through the whole body, a lot of times, like when I help women with this, we use I'm going through a compounding pharmacy. The nice thing about a compounding pharmacy is they can make it individual doses for you, and they put it into a formula that doesn't have other ingredients. Like we can make it very hypoallergenic cream, for example, or oral capsules. And so the compounding pharmacy bioidentical hormone therapy is, and even we use a vaginal suppository, it's a very clean formula. And that's one of the reasons why a lot of women will work with a practitioner like me who can do that through a compounding pharmacy and has that education. When you're going to like a standard gynecologist or GP for that matter, and I recommend women listening do this, go to your regular doctor and say, I'm interested in vaginal estradiol, because estradiol is bioidentical, and you can get it through a pharmaceutical company, and you can oftentimes even get it covered under insurance plans, and your standard doctor can prescribe it. So you can actually, that estradiol is a form of bioidentical estrogen that you can get through standard prescription methods.
Okay. So Dr. Doni, I think you're saying, maybe I'm wrong, just get clarity on this. You're saying no matter what, vaginal, estradiol or the other
Estradiol.
one, one of those at a minimum you should have.
You should have, and you're not going to use it every day, but you're going to use it at least once a week. And it's going to help decrease any kind of pain or discomfort. It's going to also help improve lubrication. So if you're sexually active, this is also going to help with that. And it's going to decrease infection risk. So it's going to decrease your likelihood of vaginal infection, including with high-risk HPV virus, and decrease bladder infections too. And so, and it can even improve the tissue, so you're having less likelihood of incontinence, less likelihood of prolapse, because this estrogen, if you think about it, it like plumps up the cells, so the cells are just happier and doing their job again, and you don't have to go through life with, you know, with this completely depleted pelvic area.
Sounds like what's not to love about it.
What's not to love about it? Absolutely. And so you're gonna talk to your doctor, and you're gonna talk to your naturopathic doctor, and you're gonna find the right solution for you. There's a lot of different options, and so I really encourage women to know it's not one size fits all. You're gonna find some women prefer a cream, some women prefer a suppository, some women prefer a little pill that they insert vaginally. So you're gonna find what works best for you, and you're gonna talk to your doctor about it, and look at the research and say, hey, is this something that's a good fit for me? Now, another thing this ties into, which is really, really important, is the microbiome. Now, I'm sure you talk about the gut microbiome.
Yeah.
And it's important to know that we also have a microbiome vaginally and in the urinary tract and the bladder too. And so
All over, right? I mean, our mouth, our skin, our eyes, everywhere.
And so we just don't hear about it
Yeah.
as much. But imagine this, when the estrogen's down, it causes the microbiome in the vagina to drop also. So not only do you have low estrogen, but if you have low estrogen, you probably have low lactobacillus vaginally. And that also just ends up making infection more susceptible and discomfort more probable. And so we need to be thinking, how do we improve our vaginal microbiome and our urinary tract as well? And so definitely, if you've needed to take antibiotics, if you've had infections, if you've had low estrogen, this is when you need to be thinking about, how is my vaginal microbiome doing? Do I need to help restore the vaginal microbiome? And the thing is, we can do a lot of restoration of the vaginal microbiome through our mouth, because ultimately our gut and our vagina are interconnected. The microbiome, the research shows, they're talking to each other. They're related to each other. So we can do it both by what foods we choose, right? If we decrease our sugar intake in our food, already we're going to, if we eat a lot of sugar, I should say that way, if we eat a lot of sugar, we're going to be more likely to feed yeast. And we're feeding yeast in the gut, but we're also feeding yeast vaginally. So if you're dealing with vaginal yeast, you're going to want to start thinking, how can I reduce my sugar intake so that I'm not feeding these yeast? And if I don't want them growing here, I better not feed them.
Yeah, don't give them the food they want.
Yeah, exactly. We have to realize, oh my gosh, no wonder they're showing up. We're feeding them.
Yeah.
It's like with birds, right? If you put the bird food out, the birds are going to come.
Yeah, they're having a party.
That, and if we can get oral probiotics that have been shown to actually improve the vaginal microbiome. So you can get these female or women specific oral probiotics to help restore the vaginal microbiome, and that can help you prevent both vaginal and bladder infections. A lot of research on that. And then we can also get vaginal suppositories with probiotic in them, so that you can actually insert new healthy bacteria vaginally, so that they can not only survive but thrive. And then you've got the estrogen back, you've got your good bacteria back, and they're actually going to protect you. I think of them as like your bodyguards, right? This is an important part of our body we tend to ignore, and we really need to make sure our defenses are up, because if we don't, that's when the pain is one thing, but as soon as someone has pain in that area, I'm also thinking they're also very susceptible to infections. And you don't want to be having to use antibiotics over and over again, or risk ending up in the hospital over this.
Yeah, you're so right. You know, I was thinking as you were talking there about the vaginal microbiome, and how we know now that like babies born vaginally, right, they're picking up the mother's microbiome through, you know, the birth canal, and that sets them up for their own healthy microbiome. And they know that babies that are, all these babies born by cesarean that aren't picking that up, are more prone to sickness because they're not getting that very first microbiome. So I've heard that there's some hospitals that even for cesarean sections, they're swiping the mother's that vagina and like putting this around the baby's face, which is
Yes.
so brilliant. I mean, really, we're perfectly designed. We really are.
Yes, there's that engineer in you
I
talking. And
can't help it.
it's so true. And to realize, because we were, for a long time, even now, we're so afraid of germs, right? We become almost like germophobic and phobic of all bacteria. And so this really helps us step back a minute and say, wait a minute, it's not about having zero bacteria. That's not the solution.
No.
Actually, what we want is we want the healthy bacteria to protect us, because our bacteria actually communicates with our immune system. And so if we want these good guys to be communicating with our immune system, because then the immune system can help protect us from infections in the gut, in the vagina, in the bladder. So these guys can protect us. So it's not about having zero bacteria. It's about how do we support our good bacteria.
Exactly. And we don't even know, I mean, this communication, but we know that they are communicating, and there's way more bacteria and other those microbiomes than there are human cells. We're kind of outnumbered, and we need to keep them happy. And then we're happy. They want us, we're their host, right? So we want to, they want us to be healthy. I would think, if they're having their little conversations around their meeting tables or their boardrooms.
I do talk about it that way, Jane. And this also comes into play with high risk HPV virus.
Yeah, I want to talk about that.
Yeah, in that this is a virus that many women are dealing with and not talking about. And so women deal with high risk HPV on their own, in silence, in secret, because they may feel ashamed or embarrassed, because high risk HPV is something that women get exposed to through sexual contact, through genital contact. And the thing is that 80% of us, 80% will test positive for high risk HPV by age 50. So it's actually a very common virus, much more so than we realize, including after age 50. Because a lot of people think, oh, that's something that happens when you're 20 or 30, or they think, oh, that happens if you have multiple sexual partners. But the fact is that it can happen even if you have one sexual partner, and it actually becomes likely again to test positive over age 50. And imagine this, Jean, it's because estrogen drops, the lactobacillus or the vaginal microbiome drops, and this HPV can just slide right in, right? It's like we don't have our bodyguards.
Yeah.
So the HPV ends up coming up. And that could be if you have a new sexual partner, and a lot of women are becoming more sexually active even over age 65. So you could have a new sexual partner and be exposed to HPV, high risk HPV, later in your life. Or it could be that you were exposed to HPV earlier in your life and your body was managing it. And then all of a sudden, when your estrogen's down and when your stress goes up, then the HPV virus can show up, because again, like you said, if these protective guys are not there helping us, they're not present or not doing their job,
The cops have left.
and the immune system is down, then
Yeah.
the high risk HPV pops in. And so I really want women to know, first of all, that I see you. I know you're dealing with this. Some percentage of you will have high risk HPV coming up even over age 65. And that if it's worth it to be tested, even if your doctor's like, oh, even if you had a hysterectomy, or your doctor's like, oh, you're over age 65, you don't need a pap smear anymore. I would say, I would recommend still getting a high risk HPV test, which is just a vaginal swab. It's a very quick and easy vaginal swab you can even do from home, and find out if you're testing positive for high risk HPV virus. Because if you are, there's so much we can do to help your body protect you from it. And the reason why it's such a focus, Jean, I didn't say this exactly before, is that the reason it's called high risk HPV or human papillomavirus, there's 14 types of HPV that are associated with cancer risk. So this is when women end up at risk, not just for infections, but now we're talking about risk of cervical cancer, vaginal cancer, vulvar cancer, even anal cancer, because of this virus called human papillomavirus that's sexually transmitted. And it could have been from a recent exposure or it could have been a past exposure, but I would rather know if you're testing positive, because then I can guide you how to protect yourself from this virus.
Mm. You really busted a myth for me, because I thought, if you've just had one sexual partner, the rest of your life, it's no problem. But that it's like kind of like the chickenpox virus, right? It can be sitting there dormant for years. And then when the cops have left the town and protection's not there, in terms of maybe the microbiome or your immune system is down, then it can just be ready to come up again. So I think you've really given us a couple of really great takeaways. First of all, make sure that you're getting a vaginal estrogen at the very least. Make
Yes.
sure that you keep getting pap smears and the high risk HPV test, no matter what your age. And no matter whether you're still with one sexual partner or even if you're not sexually active, right? So,
And even if you've had the vaccine, because some women may have had the vaccine earlier in their life, but the vaccine is not 100% effective and it doesn't cover all of the types of HPV. So
okay.
even if you've had a hysterectomy, even if you had the vaccine, I would still say, you know what? I'd rather you test, because then you can take action and protect yourself. There are women who get cervical cancer and even die from cervical cancer over 70 years old, and it's preventable.
Yeah. Well, prevention's the best cure, right? Um, is there anything we haven't talked about yet that you want to make sure the audience hears?
Well, one thing we mentioned briefly, but I really would love this chance, because I know you talk a lot about the impact of stress. And we mentioned it a little bit, but I really want women to know that even if now in your life, maybe you feel like, oh, I don't have as much stress maybe now as I did earlier in my life, still that past stress can still be impacting your health now. And
Yeah.
so what I focus in on is I measure cortisol levels. I encourage women to measure salivary or urinary cortisol at different times a day. So morning, midday, evening, bedtime, because cortisol is our main stress hormone. So it's when we look at cortisol, it's like we get to actually see what has been the impact of stress on your body at this moment in time, right? Talk about by design. Like, this is our stress hormone, and yet it's not being tested in standard blood work. The
Mhm.
endocrinologist isn't going to pay attention to it, and yet it's such an important hormone. And if we find out that your cortisol is either too high or too low, we can take steps to address it, right? Just like with HPV, we can use diet changes, we can do gut healing, we can do nutrients and herbs that, and we can do all kinds of strategies like you teach, like mindfulness and meditation, to help us restore a healthy cortisol level. And once we restore a healthy cortisol level, now you're preventing all different health issues, including infections, including cancer, including,
Mhm.
you name them all, right?
Not to
Including
mention
like
getting better sleep.
better sleep, you can prevent autoimmunity, you can reverse autoimmunity like you did, you can be preventing dementia and diabetes and heart disease, because cortisol, if you dig deep underneath all these different health issues, you're going to find stress is related and you're going to find cortisol is related, and yet it's not getting addressed in the standard blood work or the standard doctor's appointment. And so I'm here saying, let's pay attention to this. There's a lot you can do to help resolve cortisol and get it back to optimal. And in doing so, protect yourself from so many health issues, including the vaginal pain we've been talking about and the pelvic pain.
So important. I love everything that you've been sharing today. Really, like, just shining a light on some things that were so important. I've had guests on talking about hormone replacement therapy, but we weren't specifically like honing in on the vagina. So that's what we needed to do. So thank you so much for that. And that whole pelvic area that, we sort of, think we don't, not so important as we get older, but it
But it
still is
actually becomes more important,
more
right?
important.
It starts telling, it's letting itself be known for a lot of women. I'm sure, like, if you start to go, oh my gosh, like a lot of women say, yeah, I've been dealing with that, but I didn't know who to ask or what to do.
And
And
it
so
feels
just
private. It feels private and people don't want to talk about it. So I think it's so good that we're talking about this today. So what would you say, Dr. Doni, is one thing someone could do today that's going to be shifting their body into a healing state? If there's one baby step they could do today, what would that be?
Oh, I love that question. To me, it's what you've probably been hearing from me is to stand back and notice your thoughts, because a lot of times we're paying attention to what one person told us, one doctor told us, or what we heard. There's nothing you can do about that. You just have to deal with it, right? And we're listening to those thoughts that
Mm.
are just keeping us stuck and in pain, really. And in order to change that, we need to stand back a little bit, become aware of those thoughts, and to listen into like this conversation with you and I and realize, wait a minute, there actually is something I can do about this. And each time I hear that thought, no, there's nothing, you can stand back and say, actually, I'm going to choose to shift my thoughts to realize there is something I can do about this. Now, let me start taking steps in that direction. And to me, even just switching your thought pattern to what's possible already opens up so much healing. And from there, then you can go, okay, let me even just take a breath, right? Like,
Mhm.
let me even just think about, oh my gosh, what am I putting into my body that could make a difference on how I feel? What foods am I choosing? What beverages am I choosing? And how am I feeding my microbiome? Right? So you start to, all of a sudden you get a million ideas of things you can change by simply changing your thought pattern.
I love that. I love the way that little bit of advice empowers the person. And it really empowers and also helps us see that we are responsible. We're the ones responsible for what we're feeding, what we're exposing all of our microbiome to, all of our body to. I
We
love
can
that.
choose that. We can choose that. A lot of
Exactly.
times we kind of allow ourselves to let someone else be the decision maker. Like, are we going
Yeah.
to let, whether it's a microbe, whether it's a doctor, somebody else is going to decide for me. But you know what? Especially as women, this happens for men too. At some point, we can decide, you know what? I'm the best one to take care of me. I'm going to put myself in the driver's seat and start making the decisions, because this is my body, my life, my experience. I'm going to choose what I want to
I love it.
experience, right?
I love it. Okay, you've got a gift to give the audience. Can you tell us a little bit about it?
Oh, yes. The gift I have is the HPV recovery guide. So, this is especially any of you who have dealt with high risk HPV, are dealing with high risk HPV, or do the test and find out you have high risk HPV. This is the guide that shows you what's possible, how I guide women to help their body. They put themselves back in the driver's seat and they start to go, what's making me susceptible to this virus? And how can I start taking steps to change this environment in my body so that high risk HPV isn't going to thrive here anymore?
Okay, I love that. We'll have the link in the show notes, so make sure you check that out. And I know that you practice, you said mostly virtually. So how would people get in touch with you?
My website is drdoni.com. So it's DOCTORDONI.com. And you can find me there and the services that I offer. I do have some people who come see me in person in the New York, Connecticut area. And because a lot of what I offer is help with diet, herbs, nutrients, and you can go see your other provider for a physical exam and then come to me and say, okay, Dr. Doni, what do I do with this? How do I solve this? So I can do that virtually. I work with women from around the world to help them in that way as a consultant.
Mm. Gosh, thank you so much for being a guest on Wellness by Design today, but also just for this like dedication and passion you have for women's health and especially a natural approach to it. And I just love what you're doing. So thank you so much for that gift you're giving the world, Dr. Doni.
I love what you're doing too, Jane. Thank you so much for having me today.
Well, I think we're all blessed to have you as a guest today. So, and to everyone watching and listening, thank you so much for being here today. And if you know someone that can relate to anything that we've talked about today, probably a lot of your friends, share this podcast with them, because they're going to get some answers and they're going to get some ideas that could change the trajectory of their life. All right, we'll see you again soon on Wellness by Design.